Positioning and draping. Positioning and draping are techniques which maximize patient comfort and dignity and minimize injuries to tissues. The rationale for positioning is for patient comfort and decreased pain, to provide support and stability of the patient's body, trunk, and extremities, to prevent joint contractures and prevent or decrease edema, and to have access to areas which are being treated, and to provide efficient function of the patient's organ. Rationale for draping is to provide modesty to the patient, to help maintain body temperature, to have access to areas being treated, and to protect other areas of the body, and protect patient's skin and clothing. Before doing the procedure, introduce yourself first and verify the client's identity. Explain to the client what you're going to do, why is it necessary, and how the client can cooperate. Perform hand washing before and after the procedure, and assemble all necessary materials to avoid waste of time. Provide specific instruction on the position to be performed and choosing the best position for a particular patient. Erect or standing position. The purpose of this position is for vaginal examination to determine the presence of prolapsed uterus and also for orthopedic condition. First, assist the client to stand either with slipper or in bare feet on a piece of paper. Then untie the gown and leave the uppermost tape. Fold back the gown over both shoulders towards the front when the physician is ready for examination. Next is supine or recumbent position. This position is done in various operative procedures, in general physical examination, and for comfort by providing a change in position. First, replace the top sheet with a draping sheet. Then cover the patient from the shoulders to the foot part with the sheet hanging loose at the sides. Assist the patient to lie flat on his back with legs together, extended or slightly flexed. Place one pillow under the head and a smaller one may be placed under the knees. Place the arms along the sides of the body or comfortably flexed on the sides. Dorsal recumbent position. This position is done for vaginal examination, digital rectal examination or the DRE, pelvic examination, and for catheterization. First, assist the patient to lie flat on his or her back. Then separate the legs, flex the knees so that the soles of the feet are flat on the bed. Place the arms either above the head or flex with the hands on the chest. Bring the buttocks of the patient to the edge of the bed. Place one pillow under the head. Place the draping sheet diagonally in the patient so that the opposite corners cover the legs. Fold back the top corner over the chest. Wrap the corner in the right side around the right foot. Do the same with the left side. Fold the lower corner of the sheet back on the abdomen to expose the part to be examined when the doctor is ready to do so. Dorsal lithotomy position. This position is for vaginal delivery, for operation and examination of the perineum, vagina, cervix, bladder, and rectum, and also for cystoscopic examination. First, assist the patient to lie on his back. Insert leggings or stockinets as necessary. Adjust the stirrups according to the size of the patient. Separate the legs and flex the thighs deeply towards the abdomen. Elevate the legs and adjust it with the stirrups. Draw down the buttocks to the folding edge of the table. Raise the arms above the head or flex them with the hands on the chest. Place the draping sheet diagonally on the patient so that the opposite corners cover the legs. Fold back the top corner over the chest. Wrap the corner on the right side around the right leg. Do the same with the left side. Fold the lower corner of the sheet back on the abdomen to expose the part to be examined when the doctor is ready to do so. Next is Sims or lateral position. This position is used for resting or sleeping, for unconscious clients, and used for paralyzed patients, and also for rectal examination. First, you need to assist the patient to lie on either side, preferably the left with the body inclined forward. Extend the left arm behind the back and flex the elbow of the right arm forward. Flex the right thigh towards the abdomen with the knee drawn up higher than the left knee, which is only slightly flexed. Lay out the draping sheet in horizontal recumbent position. Fold back and or gather side of the sheet to expose the area to be examined. Next is prone position. This position is useful for unconscious clients and or those recovering from surgery of the mouth or throat because it promotes drainage from the mouth. Help the patient assume the horizontal recumbent position. Assist him turn over onto the abdomen. Turn the head to one side. Place the arm at the sides or flex or extend upward. allows the feet to hand over the edge of the mattress or support on a pillow high enough to keep the toes from touching the bed. Place small pillows beneath the wrist and large one under the legs if the patient stays in that position for a long time. Drape the patient horizontally. Next is Fowler's or semi-sitting position. This position promotes cardiac and respiratory functions to relieve dyspnea or difficulty of breathing and to facilitate drainage after surgery. First is you should place the patient in a horizontal recumbent position. Elevate the head of the bed appropriately. For low Fowlers, 15 degrees. Flex the knees slightly and support them with knee rolls, and drape patient appropriately. Semi-Fowlers, 45 degrees. Flex the knees slightly and support them with knee rolls, and drape patient appropriately. High Fowlers, 90 degrees. Flex the knees slightly and support them with knee rolls, and drape patient appropriately. Trendelenburg position. This position is used for surgery on the lower abdomen or pelvis and also for treatment of shock or decreased blood pressure or hypotension. First, assist the patient to a horizontal recumbent position. Elevate the foot of the bed so that the lower trunk is higher than the bed and shoulders. Support the shoulder and knees and drape the patient horizontally. Last but not the least is the knee chest or the genopectoral position. This position is for rectal examination and surgery. First, place the patient in a prone position. Assist him to kneel with the knees slightly separated. Bend forward so that the chest is resting on the bed and the thighs are perpendicular to the legs. Turn the head to one side, then place the arm either above the head or flex at the elbow and rest along the side of the head. Drapes the patient properly so that the only area to be examined is exposed.